This presentation is going to talk about the most common types of back surgery and the important information you will need to know in caring for these residents properly. The three most common types of spinal surgery are a lumbar fusion, a laminectomy, and a discectomy. Lumbar fusion stabilizes the vertebrae of the spine, creating less chance for slippage of the discs. Bone from the hip, local bone from the operative site, and other bone may be used as a bone graft. Rods and screws are placed once the graft is inserted. Bone from the hip is removed through the same incision, so the resident will only have one incision post-operatively. However, a stage surgery entails a posterior fusion as well as an anterior fusion. The anterior is done through an incision in the abdomen, so these residents will have two incisions. A laminectomy is a procedure which involves removing bone of the vertebrae to allow for more space for the nerves. It relieves pressure on the nerves and decreases symptoms such as numbness, tingling, pain, and weakness. A discectomy is the removal of the piece of disc or the entire disc that is putting pressure on the nerves. This surgery is commonly done on someone who has a disc bulge or disc herniation. Residents undergoing a lumbar fusion surgery should avoid taking NSAIDs such as ibuprofen, nasoprofen, and Celebrex for at least 3 months after surgery. If you notice any increased drainage, redness, swelling, or fever with these residents, the surgeon needs to be notified immediately. Incisions may be closed with steri-strips, staples, or sutures. Staples or sutures will need to be removed 14 days after surgery. Residents may not soak incisions until they are completely healed. The most important thing to remember about these residents is that they cannot twist or bend. Also, walking is the best activity they can do for the first 6 weeks after surgery. You should be encouraging these residents to maintain good posture throughout the day to keep the spine in a neutral position to reduce strain on the back. They should take frequent breaks by standing up and stretching at least every hour. They need to avoid lifting, pushing, or pulling objects greater than 10 pounds. The best sleeping position to reduce pain after their surgery is either on their back with their knees bent and a pillow under their knees, or on their side with their knees bent and a pillow between their legs. When changing positions in bed or when getting in and out of bed, the log roll technique should be used. A log roll is simply keeping their back straight and avoiding any twisting of their back when rolling from side to side. For example, if the resident were getting out of bed on the right side, they should log roll onto their right side and use their left hand to push themselves up onto their right elbow. Then they should slowly drop their lower legs off the bed as they push themselves up onto their right hand and into a sitting position. With both feet flat on the floor, they should use their legs to come to a standing position. Now let's watch a demonstration of a bed-to-chair transfer.
Let's take a look at a bed-to-chair transfer. Remember that residents post-spinal surgery should only be up in a chair for 2 hours at a time and then should go back to bed. Always talk to your resident first about what will happen during the transfer and any precautions she needs to follow.
Hi Linda, my name's Jennifer. I'm going to be your PT today. I'm going to lift the head of your bed up so we can roll onto your side. You should raise the bed 45 degrees.
An easy way to remember the precautions for spinal surgery is to use the acronym BLT. That's avoid bending at the waist, avoid lifting more than 5 pounds, and avoid twisting. Now we're going to roll onto your side using the log roll technique.
Okay Linda, let's bend up your knee. Bring your arm across your belly. Let's roll like a log onto your side, keeping your back lined up. Let's drape your legs off the side of the bed and push yourself up, keeping your back nice and straight.
If your resident has a lumbar brace, put the brace on now at the edge of the bed. There is no need to wear that brace in bed unless specifically ordered by the doctor. Now we're going to perform a stand and turn transfer from the bed to the chair. Place the wheelchair close to the bed and make sure the brakes are locked and the leg rests are out of the way.
Linda, let's scoot to the edge of the bed so your feet touch the floor. Keep your feet shoulder width apart.
Now you stand close to the resident too, keeping your feet shoulder width apart. If the resident uses a walker, place the walker in front of her and have her use the walker during the transfer. Guide or assist the resident by placing your hands on her hips. Never let the resident hold or hug you around your neck while you're assisting her.
Linda, push and stand up. Stay in the center of the walker. Go ahead and step forward. Okay, turn. Never twist. Back into the chair till you feel the back of the chair. Reach back with your arms. Slowly take a seat.
And that is a bed to chair transfer.